Health. Thank you all for being here for this really important conversation during this celebration of Public Health Week here in the United States. For those of you who don't know me, my name is Halkitis. I'm the Dean of the School of Public Health here at Rutgers University. And I'm honored to be here working with the Center for Public Health Workforce Development, as well as our Region 2 Public Health Training Center and the Delta Omega Society, which is the honorary society of the School of Public Health, to be part of this symposium titled Taking It to the Streets, Authentic Communication for Strengthening Trust in Public Health. And for those of you who don't know me, I will say this to you: this topic couldn't be closer to my heart. I think one of the most important elements and one of the most important jobs we have as public health researchers, practitioners, educators, scientists, is to make sure that the work that we do gets in the hands of the people who need it the most. I think too often in academia, we find that knowledge is developed, it sits on the shelves and doesn't get to the people who need it to help enhance their lives. I've often joked that for every 7 people who read one of my research articles in a journal, 700,000 people tend to read an op-ed that I publish. And so I'm hoping today we continue to have a conversation about what we need to do in the field of public health to continue to bring information that is critically important to the well-being of people and populations. I think we all understand that public health is more relevant than ever. You know, as somebody my age realizes, having lived now through 2 pandemics, the HIV one in the 80s and 90s, and now the COVID pandemic, it is very clear that we've learned some lessons over the last 40 years, but not many lessons. And part of those lessons that we haven't learned is how we continue to bolster public health in our society, how we continue to increase its prominence in our world, and to make sure it sits alongside medicine as a critical partner in enhancing, in bettering people's well-being. So the reality for us in public health also is that besides being underfunded for so long, our profession continues to be under attack. Media accounts of resignations, harassment, and threats to epidemiologists and other public health professionals have been reported in the media since the beginning of the pandemic. And a study that was undertaken collecting data between the middle of 2020 and the beginning of 2021 has now been published in the American Journal of Public Health. And it documents at least 1,500 harassment experiences and 222 job departures of the first 11 months of the pandemic, showing very clearly how we continue to do the work that we need to do, but we do it in very treacherous waters. Individuals who are working in public health, like many of you, are marginalized and disregarded. We're portrayed by many, especially those in rural communities, to be villains instead of public health servants. We have suffered from politicization and public health policies, and we have experienced disillusionment for a variety of reasons. And that, coupled with the underfunding of our field, creates great heartache for many of us. But we continue to do the work because we know it's important work that needs to be done. Public health continues to be an area that needs to grow, and sadly, our public health workforce is an area that needs all of our attention. A new report by the Big Cities Coalition has found that 28% of jurisdictions do not have a lead epidemiologist to oversee epidemiology activities. And altogether, the cities in the coalition represent 62 million people, or about 1 in 5 Americans. To reach full epidemiology capacity, the big city health departments would need to increase staff by over 47%. And so we have an obligation here at the School of Public Health to continue to educate future generations. But educating future generations has to be somewhat different, or maybe radically different, than we've trained public health professionals in the past. We need to make sure that we teach our students and we teach our research workforce that public health matters and that we must demonstrate our relevance. We need to communicate clearly to those people that we serve. We need to recognize how individuals consume their information, and we need to talk with people, not at people. I can't tell you how many nights I watch CNN or MSNBC and saw one of my colleagues talking down to most Americans. Of course, they didn't follow their advice. And so how we communicate and the manner and the tone that we use in which to communicate with populations across our country is critically important. For those of you who haven't had the chance to see this yet, my colleague David France, who produced the documentary How to Survive a Plague, has produced a new documentary called How to Survive a Pandemic. And in it, he documents the development of the vaccines over the course of the last couple of years. And in it, he also examines how a small set of individuals, of public health people working with churches in Philadelphia, were effective in communicating vaccination information to their parishioners and to people in their community, and how that sort of communication, which met people where they are, which is what we need to do in public health, ultimately led to an increase in the uptake of vaccination. So the conversation today is critically important, and I want to thank Mitch Rosen and Colleen McKay-Wharton and their team at the Center for Public Health Workforce Development for inviting me here to make these opening remarks. I challenge each of us to think about what is the best way to move forward, what is the best way to continue to communicate to the people that we serve, to listen to the people that we serve, and to use their voices to design interventions and programming that are meaningful for their lives. And I trust that this conversation will be enlightening and stimulating and potentially controversial, which would always make me happy. And we lift it up to think about how we, after we leave this conversation, how we all go out into the field and all continue to contribute and grow on our efforts to enhance the health of people and populations.